Assalamualaikum and a very good day to all of you. So today we will continue with the topic of opioids addiction. Okay, so we will learn about the history and epidemiology of opioids and opiate use and also addiction. Discuss the physical effects of opioid abuse or opioid use and the withdrawal symptoms. Discuss the impact of opioid abuse and also the treatment and management of opioid abuse or addiction. So when we talk about opioids, sometimes we refer to it as narcotic. So narcotic means that sleep-inducing or numbness-inducing. And also narcotics include opiates or opioids. So what are the differences between opiate and opioids? Opiates are the chemical compound that are extracted or refined from poppy. This is the name of the plant, and poppy is the um, it's actually have a really nice flower here, poppy flower, and we get that chemical compound from the sap or from the fiber of this plant. So this is the sap from the plant, and this chemical, the opiates chemical, is derived or collected from this sap. Okay, it's also referred to as opium, and then the derivative of opiates include morphine, codeine, and heroin. Meanwhile, opioids are the synthesized compound, and it is made in the lab, or is it? Also called synthesized. And this chemical compound can include the many drugs. For example, dextromethorphan, which being used in many cough suppressants preparation, the cough medicine. They use dextromethorphan, dextroprothiciphen, loperamide. Loperamide is the medication or the drug for diarrhea. Hydrocodone. This is the trade name is Vicodin, so it is one of the derivative of opioids. Oxycodone, oxymorphone. So these are the medication for pain relief. So these are the painkiller medication. Meperidine, methadone. Methadone is only used for treatment of opioid addiction, and also fentanyl. Fentanyl is also used as anesthetic or painkiller. Okay. So the history, a little bit of history of opioids. Before century, 2400 before century, opium was cultivated from poppy plants in Mesopotamia. So it originated in Mesopotamia. And then Hippocrates, the father of medicine, find out about this, and then he prescribed the juice of white poppy mixed with the seed of nettle as painkillers. So Hippocrates have already been using opioid or opiates as a pain relief medication. And Alexander the Great, he conquers a lot of countries, and he had expanded his empire with the use with the help of opium as a pain relief. So and also Arabs, Greeks, and Romans use it as sedative. And then in the 16th and in the 15th and 16th century, Arab traders brought opium to the Far East, because uh, Arabic countries are one of the spot of um, trading of resources during that time. And then with the with the uh, with the Arabic traders, they have actually brought opium to other part of the world. And in 1805, a German pharmacist, Friedrich Wilhelm Adam Sertuner, have isolated morphine from opium. So in originally it was used in the form of the in the original form from the opiate, from the plant itself. But then now, these German pharmacists actually synthesized the chemical compound from opium, and then he isolated morphine, and this morphine has been used as painkillers. And 50 years later, needle was invented, and then morphine was formed in injection or injection preparation, and it has been used in the medical field as painkillers. Okay? And then heroin was synthesized in 1898. And then there is a sharp rise in opioid addiction following that introduction of heroin. And then in early 20th century, an act of law was implemented to control its use. So now we learn from the history that people do not know that it is going to cause addiction, and then it seems like it is good for pain relief, and then it has been used extensively in the medical field. But then we suddenly we realize that it's going to cause addiction, and it's going to harm the users or the abusers, in terms of the health and also the societal impact as well. So that's why there is a control, um, an act of law has been implemented to control. So these are the link for additional references for you to watch. I will also put the link in the e-learn later. The opioids abuse epidemiology. So also the data here is about 5 years ago, 2016. So there are about 16,000, nearly 17,000 users of opiates from a total of 31,000. So that makes up about half of the drug users are actually using the opioid type of drug. And the effect of the brain and the body. So you probably can imagine that if it's going to be used, if it was used for painkiller before, so the effect will be on the brain, because it will lead to a temporary feeling of intense pleasure, euphoria. So euphoria is feeling the extreme happiness. It can also cause drowsiness, floating feeling, and at the same time it will also suppress the respiratory function. And effect on the cardia, it will cause hypotension and bradycardia. So hypotension, low blood pressure. Bradycardia is the slowing down of the heart rate. And the uh, opioids also have effect on the digestive system, in which it will slow down the GI motility, and the users will have chronic constipation. It's not necessarily with the use of morphine or heroin, but also the use of codeine, the use of fentanyl, the use of other derivatives of opioids. It will also have the same effect. Nervous system, in the long term, it will cause hyperalgesia, increased sensitivity to pain. So weird enough that if it is a painkiller, so it is originally used in the medical field as a painkiller, but then in long term, it will also cause hyperalgesia to the users. It will increase the sensitivity to pain, and it can also cause meiosis, constriction of pupils, and also immunosuppression. And the addiction of opioids, it can develop very quickly, even with minimal use. Can cause physical and mental dependence of the for the users. So physical addiction, meaning that the user's body craves the drug. So if they have used it for a long term, and then they suddenly stop using it, so the body itself will have the withdrawal symptoms like shivering or runny nose, and then insomnia. So that means that the body itself is not adapting to the new to the new chemical. So that means that the body is missing that compound, in order for them to behave or to have a normal function. Can also be so meaning that the body has already accustomed to the presence of that compound. So if there is not so if the drug is not in the system, so they will develop these symptoms. Can also be so the users can also have um, mental addiction, meaning that they are craving that drug. So they consciously feels that they need to use the drug. So the effects of addiction can temporarily reduce in pain and anxiety and create a sense of numbness in the body and mind. So they might not feel the sense of consciousness. They might not behave like themselves. They might also sense the stimulus around them differently as normal people. So in high doses, it will create a short-lived feeling of euphoria. So it's hard for them to stop taking it because they want to continue feeling that euphoria. So how do you know that the person is having the opioid dependence, or when they started to uh, become addicted to opioid? So when do you when will we when it is time for us to actually take action or try to intervene if we find that so when do you know that the person is having warning signs of opioid dependence? The first is an increased tolerance to the drug, meaning that the use or the amount of intake of opioid um, needs to be increased for them to have the same effect. So when they started to have tolerance to the drug, meaning that they are already dependent to it, and then they need their body has accustomed to the presence of the drug, and um, it is actually a red flag. So it is actually a warning signs that the person might have a dependence. The second is the inability to stop or reduce usage, even though they have the will to stop or reduce the usage, but they cannot do that. They are not able to stop usage. So that is when we need to intervene. The third one is the withdrawal symptoms when stop using, meaning that when the person is the withdrawal symptoms when they stop using, a desire to keep using even when health complications arise, meaning that even if they have for example, they have hyperalgesia, they have hypotension, they have respiratory depression, they still continue to use it even though they know it will cost them their health and impact on quality of life, including relationships and employment. So that meaning that when their continuous use is going to affect their employment, they will, for example, it will if it affect their performance at work, they're being they're being terminated from job. For example, they cannot keep commitment in relationship. It have impacts of quality of life. So that means that they have a problem. Next is spending excessive time and money on drugs. So this is what we have discussed before. Excessive sleeping or extreme weight loss again. So that this means that they have already developed the physical in fact the physical changes due to this use, and also turning to crime to pay for more doses. The impacts of opioids abuse in terms of the health includes the opioid intoxication symptoms. So this is when the person is being intoxicated by the drug, meaning that the time when the person is using it, and then they become high, then they do things that is not acceptable in the society, or when they want to hurt other people and their judgment is impaired. So that's when the health is going to be implicated in that way. The second is drug related morbidity, meaning that it will cause them to have uh, cardiovascular cardiovascular damages, like respiratory impairment. Third, lifestyle problem. So that is when it's going to affect their health in general, in which they would not have a proper diet, because that's the only thing that they want to take is the drug, and then they lose the appetite, and that they do not really care about sleeping, or they oversleep. So this is when they have a lifestyle problem. And related to the uh, society and the community is the blood-borne viruses from unsafe injections. So this is the one of the main problem related to the injectable drugs. For example, the diseases that can spread through the injection are, as we all know, the HIV, hepatitis B, hepatitis C. So this is when the government take action on the implementation of the needle and syringe exchange program, right? And also the risk of overdose. So when they took their doses, maybe they are experimenting. They probably do not know the consequences, and then they don't really care about their their well-being. There is a risk for them to have overdose, which might cause a fatality. So these are the facts and figures on Malaysia's harm reduction program. So we have discussed briefly before, from 170,000 people who inject drugs, um, 18.9% have HIV. 67.1% have hepatitis C. During this time, which is a bit outdated, in 2014, we have 811 number of methadone program sites. And I think the number has already increased by now. So we have a lot of methadone program sites, which include the ones from the Ministry of Health, and we also have the private clinics who had this program as well. Impacts of opioid abuse on socio-economic factors. As we have mentioned before, about the loss of productivity, of course, when they are intoxicated, or when they are having this addiction problem, they cannot really focus on the job, and then they do not perform well in their work. So it will lead to an unemployment, and also legal problems if they commit crimes. It will cause themselves to get arrested, and so on. Antisocial behavior, there is an increase for violence, for example, domestic violence among family members and partners, and also marriage problems, family problems, as consequences to that, and also social marginalization or stigmatization by the society, crime, and also accidents. Many of these impact, or many of these acts uh, is going to violate their acceptance in the society.